on different occasions. But we appreciate the presence of each and every one of us here as we lay it bare, discussing the next check of the point blank. You are all welcome.
Well, let me also welcome every one of us one more time. Good afternoon, my wonderful and colleagues, fellow of PSN in the room, various office holder in our society, and every one of us. I'd like to welcome all of us to this, our session, Point Blank, Lay It Bare. And just like Mohammed just mentioned to us, this is one of our flagship events in the Pharmacist Affairs. And we have been running this event for the past 6 years. And Point Blank is one of our current affairs engagement platform where we engage ourselves and try as much as we can to speak on issues that pertains to our practice environment. Let me also mention at this junction that this is put together by members of the Board of Administration of Pharmacist Affairs, and it is just one of those events we have put together so that we keep on speaking about the environment we have found ourselves in, our practice environment, and as a result of this, also come up with opinions on how we can address some of the issues that are actually affecting the practice of pharmacy. At the board level, we agreed to look at this subject, this topic this afternoon, which is tackling manpower shortages in healthcare. Is pharmacy profession endangered? Is one topic that is topmost in the minds of many colleagues, because when we started mentioning about this event, a lot of people showed a lot of interest because every one of us are seeing that manpower shortage is really affecting our practice. So at this juncture, let me quickly recognize people that are on call this moment. Pharmacist Aminu Muhammad, you are welcome. Pharmacist Beatrice Obiageli, you are welcome. Brown Girl, well, that's the name, you are most welcome. Pharmacist Chidozi Okoye, we welcome you. Pharmacist Chioma Omata, Dr. Zango, Pharmacist Nioma Upong, Pharmacist Foluka Akinera in FPSN, Pharmacist Grace Ekanin, our CPC chair, ACPN conference holding next month on the soil of Oyo State. Pharmacist Afsat McCarthy, Pharmacist Issa Muhammad, Pharmacist Jumoke Akipelu, Professor Michael Aduku, Muhammad Yusuf Wakili, Murtala Umar, Pharmacist Nike Ola, Pharmacist Raymond Okechuku, Pharmacist Samira Abukaka Umar, Pharmacist Sojo Oyeni, Pharmacist Solomon Ikefan, Pharmacist Tajuddin Ajibola, Pharmacist Taufik Oladipo Odukoya, Pharmacist Titila Yoafuye, Trinity Pharmacare, Pharmacist Obadulai Al Hassan, and Pharmacist Yusuf Fatiman. We welcome all of you to this call this afternoon. And just like we have mentioned, it is a call that we are looking at to discuss issues that affects the practice of pharmacy and how the current issue in our nation could likely be a challenge to our practice. So I'd like to welcome all of us one more time and say this afternoon, especially all our guest speakers, the panel of discussants, the lead speaker, our moderator, and they're all in the room already. This is one of the programs that we have been doing year in, year out. This year, this is our first edition this year. We're looking at this particular topic, manpower shortage in healthcare. On behalf of my members in the Board of Administrators, I would like to mention a number of them that are on the call right now, and some of them that are not here. And we have in the room our ever active and agile member, Pharmacist Foluke Akiniroyi, FPSN. You are welcome to the call this afternoon also. Always fighting forward colleague is also one of our members. And other members that are not here, we have Pharmacist Benga Olubowale, Pharmacist Titilayo Onedo, Pharmacist Michael Durowaye, and we also have Pharmacist Richard. So all of us are the Pharmacist Affairs. We welcome you, and we believe that this session this afternoon is going to bring a very good interaction to look at the topic at hand and be able to give a very good direction towards it. So at this junction, I'd like to call on my colleague in the Board of Administration, that is Pharmacist Foluke Akiniroyi, who will be introducing to us this afternoon our lead speaker, Our lead speaker this afternoon is Pharmacist Mohammed Musa Zango, the retired MD, NNPC Medical Services Limited. So, Pharmacist Akinori, over to you.
Yes, thank you so much, my chairman, and everyone in the room right now. Pharmacist Dr. Mohammed Musa Zango, FPSN, FNA Farm, FIHIMN, FOSHA, FIPN, FCAI, and FCIPMN. He's a pharmacist, creative, and seasoned business administrator who was a key player of competence in the delivery of quality and safe healthcare in NNPC Medical Services Limited for over 34 years. At NNPC, Pharmacist Musa Zango was team lead for business development of the Ventures Business Development Directorate of the new NNPC. He was the brain behind the concepts of establishing one, integrated world-class multi-specialist hospitals, two, comprehensive radio diagnostic centers, and three. What is it, sir?
Are you giving me a pen?
What do you say?
I'm not sure I was. He's supposed to mute his microphone.
You can't hear me?
Please go ahead, ma. Please go ahead. That was an interruption.
Sorry about that.
Go ahead. Please mute if you're not talking. Yeah, thank you. Three, drug manufacturing company by NNPC as a way. As a way into non-oil businesses to add to the corporate bottom line. Pharmacist Dr. Musa Zango is a man of many parts, a seasoned and well-rounded individual who served in various capacities and distinguished himself as a man of integrity and excellence throughout his career life. Time will not permit us to recount all, unfortunately. However, some more noteworthy accomplishments include: he was a board member, NNPC Medical Services Limited, board member, NNPC Health Maintenance Organization, board member, NNPC Foundation, member, Board of Trustees, NNPC Ogonu Golf Resort Warri. He is a fellow of the Pharmaceutical Society of Nigeria. He's a fellow, Nigeria Academy of Pharmacy. He's a fellow, Occupational Safety and Health Association, FOSHA, UK. He's a fellow, Institute of Health Insurance and Managed Care of Nigeria. He's a fellow, Institute of Planning, Nigeria, fellow Corporate Administration Institute, fellow Chartered Institute of Project Managers of Nigeria, a member, Society for Quality in Healthcare in Nigeria, member, Chartered Institute of Directors, distinguished alumni of the University of Benin, and life patron, Pharmaceutical Association of Nigerian Students, PANS, a member of PANS National Hall of Fame, married with lovely children. Esteemed colleagues, let us give it up to our lead speaker, Pharmacist Dr. Musa Zango, and join me in welcoming him again to this platform. Sir, thank you for honoring our invitation this afternoon as our lead speaker. Please, let's give it up for Pharmacist Dr. Zango. We can unmute and just welcome him, please. You're welcome, sir. God bless you.
Thank you very much.
You are welcome, sir. God bless you.
All right.
Thank you very much indeed. And let me say good morning to all my colleagues that are here.
You're welcome, sir.
Thank you, ma'am. So time is not on our side. I will just hit the ground running.
Well, sorry. Let's hold on. We are still Dr. Zango. We are still going to introduce other people with us in this platform.
Everybody,
Then
the
we'll
whole
call on
panel.
you shortly too.
Oh, okay,
Yeah,
that's
we're going to, so just a minute, we'll get back to you. Thank you. That's great. Thank you. So we'll welcome Pharmacist Isa Muhammad to take on the next guest this morning. Thank you.
Okay.
Pharmacist Muhammad.
Yes, sir. Thank you, sir. So I'll be introducing our next speaker, who is pharmacist Dr. Murtala Isa Umar, who is a public health pharmacist and a deputy director, Department of Pharmacy, Aminu Kano Teaching Hospital in Nigeria. He is also the coordinator, experiential preceptor, and part-time lecturer at the Department of Clinical Pharmacy in the Faculty of Pharmacy, Bayero, Kano. Dr. Umar obtained his B.Pharm at UniJos and then did his residency training in Aminu Kano Teaching Hospital before obtaining his fellowship with the West African Postgraduate College of Pharmacy in 2014. He further obtained his MBA with Bias Entrepreneurship, then a master's degree in health economics, and another master's degree in pharmacology. He completed his Doctor of Pharmacy degree in 2019 at the University of Benin, Benin City. Dr. Umar was the former National Financial Secretary of the Pharmaceutical Society of Nigeria. That was 2019 to 2022. And then he became the current PSN chairman of Kano State, my PSN chairman. Is passionately interested in pharmacovigilance and pharmacoeconomics. Ladies and gentlemen, I present to you Dr. Murtala Isa Umar. You're welcome, sir.
You're welcome, sir.
Thank you so much.
I'm most welcome to our midst this afternoon, Dr. Umar.
Welcome.
Thank you very much, sir.
You're welcome.
I'm happy to be here.
It's my
Pleasure.
singular honor to introduce pharmacist Taufik Oladipupo Odukoya. He is a seasoned pharmaceutical management professional with over 20 years of experience. He holds dual master's degrees in pharmacy and business admin and has built a successful pharmaceutical chain business, Vanguard Pharmacy Limited, which he built from scratch. As CEO, along with his team, they have transformed the brand into a leader in community pharmacy in Nigeria, employing over 400 staff and committed to patient care and community development. His expertise spans pharmaceutical, clinical services and research, entrepreneurship, business management, market development, and customer relations. Pharmacist Odukoya has been appointed as an adjunct lecturer in two different faculties at the University of Ibadan: pharmacy and economics and management, where he shares his knowledge and insights with future pharmacy and business professionals. Pharmacist Taufik Odukoya will be bringing his wild and deep experience to bear on the discussion with insights on how to change the narratives. Please let us give it up to pharmacist Taufik Odukoya, Vanguard Pharmacy Limited, as we welcome him to this platform and discussion this afternoon. You are welcome, pharmacists. God bless you for honoring our invitation.
You're welcome.
You're
as
welcome.
one of the panelists. Thank you.
Thank you.
Welcome, sir.
I'm excited to be here as usual.
Yes.
Yeah, thank you.
You're welcome.
Yes.
So Umar, Mohammed, next person, please.
I'm going to be taking the resume of Professor Michael U. Adiku. Professor Adiku graduated from the Faculty of Pharmaceutical Science, University of Nigeria in 1986. He worked as a hospital pharmacist upon graduation from 1986 to 1990. In 1990, he joined the services of the University of Nigeria and rose to the rank of professor in 1998. He teaches and researches into various aspects of pharmaceutical education and particularly raw materials utilization and sustainability, as well as health sector reforms and public health. Currently, he has over 260 research articles in both national and international peer-reviewed journals and over 100 papers presented at both local and international conferences. 10 of his postgraduate students are currently professors of pharmacy in various universities, and 2 of them are currently vice chancellors in 2 Nigerian universities. Wow! In 2007, he was appointed the National Coordinator of Science and Technology Education Post-Basic, Step B, a project aimed at improving post-basic and higher education system in Nigeria through the World Bank IDA system. Under this project, 11 centers of excellence emerged based on various national needs. He has both local and international experience in the pharmaceutical industry, especially in education and research, as he has visited overseas laboratory thrice as an Alexander von Humboldt Fellow in Germany, 1990 to 2000, a Masumai Fellow in Japan, 2002, and a Royal Society Fellow in Manchester, United Kingdom, 2006. In the area of international grants, he has won a research grant from the Royal Science of Chemistry of Great Britain, 2002, a grant from the Third World Academy of Sciences, Italy, 2004, and another grant from the International Foundation for Sciences, Sweden, 2004. Locally, he has won, he has won grant from the National Institute for Pharmaceutical Research and Development, NIPRID, Abuja, and another grant from Welcome Nigeria Trust, Lagos. He has had trainings at the World Bank Institute in Washington, USA, Harvard School of Graduate of Education in Boston, USA, and at the Hebrew University in Israel and Innovations in Higher Education. He has also had trainings at the Galilee Management Institute in Galilee, Israel. He has had other trainings at the Third World Academy of Sciences, now Academy of Sciences for the Developing World, Trieste, that's in Italy, on bioinformatics and drug development. Trainings on entrepreneurship at the E41 Impact Foundation at the Catholic University of the Sacred Heart, Milan, Italy, and another training on entrepreneurship at the University of West of Scotland, United Kingdom. Is a fellow of the Nigerian Academy of Sciences, FAS, a fellow of the Pharmaceutical Society of Nigeria, FPSN, a fellow of the Nigerian Academy of Pharmacy, a fellow of the Association of Nigeria, an honorary fellow of the Science Teachers Association of Nigeria, an honorary association of Nigeria, an honorary fellow of the Entomological Society of Nigeria, FESN, is a member of the Institute of Public Analysts of Nigeria, MIPAN, is a fellow of the African Institute, FASI, a fellow of the Chartered Institute of Leadership and Governance, FCILAG, USA, fellow of the Institute of Oil and Gas Research, is a fellow of International Society of Comparative Education, Science and Technology, and the founding president of the Nanomedicine Society of Nigeria. He has won the Nigerian Prize for Science 2006 and the May and Baker Prize for Excellence in the Practice of Pharmacy 2009. In 2019, he was awarded the World Academy of Science Prize for Development of Materials for Use in Science and Technology. He was the Vice Chancellor, University of Abuja, from 2014 June to June 2019. He is happily married with children. Ladies and gentlemen, please let us clap our hands for our professor. You are welcome, sir.
Thank you very much.
You're welcome,
You're
sir.
welcome, Sam.
Thank you very much.
God bless you. Thank you for honoring our invitation.
Thank
And
you.
the last but not the least panelists, I have the singular honor to read the citation of pharmacist Mrs. Dayo Adetola, Merit Award winner, MSc Marketing, MBA, PGD, FN, IMN. Pharmacist Dayo Adetola graduated from the University of Ife, now OAU, Ile-Ife, as the best student in the Department of Pharmaceutics. She has a master's degree in business administration from the same institution, as well as a master's degree in marketing with the University of Salford, United Kingdom. Pharmacist Adetola, a Merit Award winner of the Pharmaceutical Society of Nigeria, is a well-rounded pharmacist of over 3 decades with vast managerial knowledge and experience in sales and marketing of pharmaceutical products and vaccines. She's a learning and development practitioner for over 20 years and a certified trainer by Industrial Training Fund, ITF Nigeria. She's a sales and marketing accredited trainer, certified by prestigious University of Cambridge, United Kingdom. A trainer by International Labour Organization, ILO, on how to start and improve your business and also generate business ideas. She's a certified health, safety, and environment trainer. She holds a postgraduate certificate in global mental health from the University of Washington, USA. Pharmacist Adetola is a fellow of the Institute of the National Institute of Marketing and Marketing of Nigeria, NIMN, and a fellow of the Nigeria Institute of Training and Development, NITAD. Pharmacist Adetola was a recipient of numerous awards and recognitions in GlaxoSmithKline, and as a tutor in GSK, she had several overseas trainings in Belgium, London, Kenya, and Dubai. Pharmacist Adetola, can I just ask, what are you still doing in Nigeria? Let's give it up to our wonder lady, Pharmacist Dayo Adetola, because before leaving GlaxoSmithKline to private practice, she was the head of training for Anglophone West Africa pharmaceutical operations. Pharmacist Dayo Adetola is currently the principal consultant for Boscon & Co., a human capital development firm, providing services for several companies in the country, both indigenous and multinational. Please once again join me as we welcome Pharmacist Dayo Adetola as one of the panelists for this afternoon's discussion. You are welcome and God bless.
You are most welcome, Pharmacist Adetola. Well, I will be taking the last of our guest participant this afternoon,
Okay.
and the guest speakers rather. I will be taking on the moderator for the panel discussion.
Okay.
And this event is packaged in such a way that we have a lead speaker, that's our Pharmacist Zango, and that's going to dovetail into the panel discussion, where the panelists will be looking at his presentation, and we're going to synthesize opinions on how best we can tackle the current manpower shortage in healthcare and how it can be avoided from endangering pharmacy practice in Nigeria. I'd like to bring to our space Pharmacist Chidozie Okoye. Pharmacist Chidozie Okoye is our moderator for the panel discussion this afternoon. And Pharmacist Chidozie Okoye is a pharmacist, a barrister, and an homeopathic physician. So 3 professionals in one. He's an associate professor of homeopathic material medical at International Open University, Salonika, Greece, and also a lecturer at the Nigerian Institute of Homeopathy, Enugu. Among other things, is the state chairman, Association of Community Pharmacists of Nigeria, Enugu State, and is a known face in our pharmacy environment. So this afternoon, I'd like to welcome you and let us join our voice to welcome Pharmacist Chidozie Okoye to this our event this afternoon. Pharmacist Okoye, you are most welcome.
It's Chidozie, good to see you again. Thank you for honoring our invitation.
Thanks, yeah. Thanks, everyone.
Thank you. Yeah.
Right. So without wasting too much of our time, we would like to progress speedily because time is of essence and we know it will never be enough. So let's, as much as we can save time, like us to do that appropriately. Well, today's discussion centered around tackling manpower shortages in healthcare. And we're asking the question, is pharmacy profession endangered? We are all aware of the trend, the Jackpot syndrome, and how many people who are in the healthcare discipline has emigrated from the country. As at the last count, we have almost 100,000 healthcare workers that has left the country in the last 4 or 5 years. And that can tell us the depth of challenges that is bringing to our practice environment. As pharmacists and as a pharmacy profession, we are all aware that manpower is our strength. Where the manpower is not available, substitution with lesser quality professionals is inevitable. And also the presence of charlatans taking over the space. And we know that from a very long time, pharmacy has permanently been fighting the recognition war. We need to project ourselves. People need to know what we do. And we are now being faced with emigration of the few hands that we have in our country, leaving the space open to those who are non-pharmacists to take on services that are pharmacist duties. Also, it's of note that every year, on average, PCN inducts about 2,000 young pharmacists to the profession. So, which means we may necessarily not have any problem if those 2,000 every year are practicing pharmacy or they're integrated into pharmacy practice. But what we have, many of them have taken the Andrews path. They have checked out of the country. And all of them are also into other environments, other endeavors. Some of them are mostly into IT. So meaning that the profession they have been trained to occupy, they are leaving it behind. And if we don't want pharmacy profession to go into extinct or maybe becomes to be at the backside, then we begin as stakeholders to begin to speak about it, because we believe that when we keep on speaking about it, the ideas to change the scenario will come and people will take on responsibility that they would need to really change the narrative. It's on this note that we are presenting this session this afternoon. And we have pharmacist Mohammed Musa Zango as our lead speaker. He's going to give an overview of the manpower shortage in the healthcare. And I believe strongly he's going to come up with some opinions on how we can mitigate it from affecting our practice adversely. So I'm going to yield the floor right now to pharmacist Mohammed Musa Zango, who is going to be taking us in the next 20 minutes to share his opinion and views in a short presentation that he has. So pharmacist Zango, over to you at this junction. You are most welcome to take up the stage right now, pharmacist Zango.
Thank you very much, Pharmacist Abiodun. You have already spoken on the topic. I will only add a little to what you have said. So thank you very much. I say once again, good afternoon to all my colleagues that are on board, and I wish you a happy Democracy Day. Let me first of all appreciate the organizer, particularly my friend, the fellow, Abiodun Ajibade, the conveyor and the board of administration of Pharmacist Affairs for initiating this program and also sustaining it. I'm looking forward to when it will metamorphose into electronic media platform so that the message can get across to do that is supposed to know, especially the policymakers. I have sent you the slides just in case I have issues around sharing. And I didn't even know what happened. Can you hear me?
We can hear you. You want to share a slide, you can go ahead.
All right. So I just want to share my screen. I don't know if you can see my screen.
Okay, it's coming up.
Can you see my screen now?
We can see your screen.
Yes, we can see.
Okay, so the topic we are addressing today is tackling manpower shortage in healthcare. I added in Nigeria so that we can give a kind of boundary to our discussion, and then we can limit the scope to our dear mother Nigeria. So I'm going to do that. You can notice a few here and there that can be corrected.
Your
All right.
screen is not shared properly.
An analysis of manpower shortage in healthcare in Nigeria. Currently, 1 in every 4 medical doctors, 1 in every 20 nurses, and 1 in every 8 pharmacists that are trained in Africa are working in developed countries, which is accounting for 1.5 million healthcare shortfall in the region. They are all Japan. They call it Japan syndrome. Now, also, the WHO projected a shortfall of 6.1 million health workers by 2020 in Nigeria and other African countries. In Nigeria, the health workforce density is estimated at 1.95% per, 1.95 per 1,000 workers as at May 2017, which is below the WHO threshold density of 4.45 health workers per 1,000 people. So it's very clear there is shortage of healthcare across all nations. Now I will take an analysis of the manpower shortage in pharmacy profession in the country. Pharmacists are critical and in fact indispensable partners if you must attain the goal of universal health care coverage and equitable access to essential health services, particularly in relation to medicine access and expertise of the pharmacists. Nigeria has a shortage of pharmacists, no doubt about it, with a ratio of 1 to 3,000 patients, which is below the recommended ratio of 1 to 1,500 patients by WHO. Well, some literature are saying 1 to 2,000, but plus or minus, we are far below. According to the WHO recommendation, the ratio should be 1 to 2,000. However, in Nigeria, as of September 2023, that ratio is 1 to 13,385. One pharmacy serves 13,385 Nigerians. Again, geographically. According to Pharmacy Council of Nigeria, there are 33,000 registered pharmacies since the creation of the council in 1936, and this figure has remained the same today. Out of this, 19,000 of them are available. Sorry, there is a mix-up. PCN registered show 33,000 pharmacies. This has been the case since inception. Out of that, 19,000 are ones that are currently licensed to practice in Nigeria. Out of this also, not fewer than 2,863 they have left the country seek for greener pastures between 2018 and 2020. Further analysis as 3rd September 2018 showed that there are more female pharmacists, about 62% compared to female. It is up 30%. While 50% of patients from non-area of practice are in the community, only 11% are in hospital pharmacy. So we can see the level of shortage. In 2022, Let me a little bit of this report from American Association of Colleges of Pharmacy data that says 33, sorry, 13,323 graduates from four-year pharmacy program where a kind of took off against the 14,223 in 2021. This is the largest drop that they noticed since 1983. At the same time, also, United Nations Department of Economic and Social Affairs said Nigerian population has reached 216 million, which is counting for 2.7% of global population. And going by this figure, Nigeria has 1 to 13,385 pharmacies population. This is what I have said earlier. So it is very clear that for us to achieve United Nations Sustainable Development Goal target for universal health coverage by 2020 is going to be a serious dilemma for us. And that cannot guarantee medicine security, which will in turn guarantee health security. Allow me also to compare to a study that was done in 2018 and it was published in PubMed, where they analyzed the workforce in Nigeria for 6 years between 2011 to 2016, so that they can get into an insight into whether they are short or otherwise. The result of the analysis led to a conclusion that there is an ongoing serious deficit in availability and supply of pharmacies in the country, with widespread variance in distribution observed across 36 states, including FCT. And the findings suggest that the observed deficit were not only or solely related to out-migration. It highlights the need for policy change that will promote in-country availability, equitable distribution of pharmacies, and retention of pharmacies, clearly in underserved region of North and Northwest. It is therefore very obvious there is shortage of pharmacies in Nigeria. You can refer to the WHO recommendation and help me come out with actual ratio that we have. Now, what are the possible reasons for this shortage? In my own opinion, number one will be the brain drain, because many Nigerian pharmacists have left the country in search of better opportunities, and this has led to the Japa syndrome that we've been talking about. Now, inadequate infrastructure and poor remuneration might not be responsible for the shortage of pharmacists, but is a very critical factor that can lead to brain drain, because equipment are not there, the facility where they are not very conducive, and there are no incentives to retain the pharmacies that we have. We have also noticed an aging population among the pharmacists. Many are retiring. We are not producing more pharmacists, and the few ones that are produced are not encouraged. There is limited also training capacity, poor working conditions like competition, and you don't have pharmacists around the rural areas. Then there is also an over-reliance on trained personnel. So this actually create a kind of distraction for us, because we, or rather the community, believe that they can do with the untrained people who are not pharmacists, but practically doing the pharmacists. How is the pharmacy profession endangered by manpower shortage? What are the implications? So these are questions that are going to be dealt with, I believe, by the panelists. But let me just share my own opinion. And I believe that the profession is endangered by manpower shortage in several ways, including reduced patient care, increased workload, decreased quality of care, delay in medical education management, limited access to specialized services, economic implications are also there, decreased community engagement, impact on rural and underserved areas, reduced research and innovation, and negative impact on student training. I really didn't want to go deep into each one of these because of time factor, but the summary is there from my own perspective. Endangering pharmacy profession as a result of manpower shortage will lead to inadequate access to quality medicine, pharmaceutical care, and this will also lead to medicine insecurity, and by implication, health insecurity, and inability to attain universal health coverage as well as achieve United Nations Development Goal. So this is just a summary, but if you take each of these points and highlight it, you will realize how much the profession is endangered. Now, the next thing is how do we tackle the manpower shortage in Nigeria? Again, here, the panel will do just to this, but let me also share my own opinion on this. Number one, to tackle the manpower shortage, particularly in the pharmaceutical setting, it requires a multifaceted approach. But here are strategies that could be adopted. One, workforce planning. You have to learn, do an appraisal to find out how much you require and plan ahead of time. Because I know that it requires also money for you to recruit. Then the second thing is recruitment initiative. We need to have that political will, really recruit pharmacists to bridge in the gap. Then the pharmacists that are already in the system, they should be trained and developed so that they can deliver on the expectation. Then retention strategies, and then adaptation of technology, especially modern age, that can also help to reduce the pressure as a result of manpower shortage. Then tax delegation. This is really happens in the system where the pharmacists are working. Then the need for collaborative practice and flexible starting model. Then international recruitment. This is for the purpose of technology transfer. Then what you call the pipeline development. Then of course, wellness initiative and data analysis. So all these are strategies that you can adapt to ensure that you address the issue of manpower shortage. But principally is to have the infrastructure, to create the conducive environment, to pay them well, provide incentives, and redevelop them. So I put everything in a summary of what I call the 4 Rs. Now, these 4 Rs stand for retain, recruit, redevelop in terms of training, and re-engineer. That's in terms of technology deployment that can ease the problem of power shortage. Now, we have this slide call for urgent action, which I believe at the end of this discussion, the program, we should be able to reach out to policymakers, tell them the need for the Nigerian government and all the relevant stakeholders to take the bull by the horn to recruit pharmacists so that the issue of manpower shortage will be addressed. This is very, very vital if we are to be self-reliant in medicine, if we have to have this medicine security, if we have to achieve the United Nations Development Goals. It is very critical very important. Let me also share with you, I know I have only 20 minutes, some of the experiences or the initiative we brought while I was in NNPC to address this issue that we have seen long, long time ago. One of them, first of all, to get the place accredited by Pharmacy Council of Nigeria so that we will get opportunities for pharmacies to be employed there. And I'm happy to say that as of today, we have got approval before we left, and they are making some moves now to get some pharmacies on board. The present PSN registrar was actually the one that helped us out to get that approval. Then we also believe that by developing integrated multi-specialist hospital along the region within the Nigerian uh, nation will be able to provide opportunity for employment not only of pharmacists but of other members of the healthcare delivery system. Before we left, we were able to develop studies that show the feasibility uh, and also the profitability of having such a hospital. So today we have landed property in Port Harcourt, Lagos, in Maiduguri.
From Zango, your voice is no more heard. Or anybody hearing him?
No, I'm not hearing him.
No, sir.
We are not hearing him anymore.
Yes, I think that should be network issue on his side. From Zango, we are not hearing you again. Hello, Famizango. That he had network issues. That's why it's disconnected. It should be back again. Sorry, it's connecting back again. It got disconnected. So it's connecting back right now.
Awal Mahmoud Mohammed. Say Jesus. Gama ganin ka.
Dr. Zango, are you in the room now? Okay. He's in the room now.
Amy.
Okay.
Hello.
Yeah, welcome back, Dr. Zango. All right.
Well, thank you very much. I didn't know I was, offline. I was caught up, and I was just talking to myself. I'm sorry about that. I don't exactly have an idea where I stopped. If you could just please.
Well, I think you were speaking about when you bought some landed properties, something like that.
Okay, so I don't really need to share the slides anymore because I think that's the last part of the slide. The issue I was talking about is just the experience while in NMPC, where we feel the need to have integrated multi-specialist hospitals that will create opportunity for the entire, healthcare workers, doctors, nurses, and pharmacies. But for pharmacies in particular, we wanted to have the pharmacy operating on its own as a commercial entity. That will require quite a number of pharmacies beyond what we normally employ, and that will create opportunity and bridge the gap in terms of manpower shortage. So by doing that, we would be able to serve the community, we serve the hospital facility, and also serve the outpatient, generated. We wanted them to have even a salary that is beyond what is obtainable outside, just as a way of retaining them and attracting some, but that became a challenge. So we converted that to incentives, and I think I left it at that level. They were still discussing it. Outside that, we also said we need to have a drug manufacturing company owned by NMPC, and also a drug distribution, mega drug distribution a company that will operate in collaboration with the PSN, because PSN has I think what do you call the ULCO. So before I left, we have started engaging them, and I believe that is not going to be in vain. That they will continue. We will continue to support them from outside to make sure that that is achieved. So with all that, we will be able to employ more pharmacies. We will, reduce the gap in terms of manpower requirement, and also the manufacturing company, which will start with IV fluid, move to solid dosage form, and then bring in as many product line as possible. Is going to be a very huge factory that will require the services of pharmacies. So that will also create opportunity to reduce the manpower shortage within the country, because you'll be able to keep these pharmacies within the system. So this is really the summary or the short of the experience that we have with NNPC. But I'm very optimistic with the caliber of the panelists that we have. They will do justice to this particular topic. And then at the end of the day, we will come out with a recommendation that will ensure that they reach to the appropriate quota. So thank you very much once again, the conveyor and the team and everyone on call for giving me this opportunity. And I will stop here, or I'll put aside here until I come back on board. Thank you very much.
Thank you so much, Mrs. Zango, for that wonderful presentation. It is loaded.
Thank you so much, sir.
Full of insights, and he has spoken not locally but globally. And just like he mentioned, our erudite panelists, they will do justice to this topic, and they're going to be drawing from their field of practice. Mrs. Zango has presented so much points on the ground. What can be done to harness the strength, to retain the strength, to redeploy, to re-engineer. So many things he has said. So we're going to be going to the panel session this time, and we'll be handing over to Pharmacist Chidozie Okoye, who is going to be leading this session. And I believe strongly he has enough information at his disposal that he's going to engage the panelists with, because I know all the panelists are going to be talking from down direction of practice. We have a community pharmacist on the platform. We have an academic pharmacist. We have administrative pharmacists. So also we have industrial pharmacist on this particular call this afternoon. So pharmacist Chidozie Okoye, over to you to take us on the next session. Thank you very much.
Okay, thank you from Ajibade, and I greet everyone in the house. I thank Dr. Zango for that well laid out presentation. Unfortunately, technical issues are interfered. So we're going to run quickly so that we can get done with. So for the panel discussions, we will spend around 20 minutes. Each panelist will take not more than 5 minutes, so that the remaining 20 minutes we can use it for questions from from the audience and other comments. So the topic for today, tackling manpower shortages in healthcare. Is the pharmacy profession endangered? Well, I will not make my own comments now. Until later, when all the panelists have made theirs. So we take off. And the first panelist that I want to ask his opinion and perspectives on the topic is my teacher at the university, Professor Michael Adiku Umale, former Vice Chancellor of the University of Abuja. Sir, can you, in not more than 5 minutes, give us your perspective on the topic? Apart from what Dr. Zango has already given us.
Okay. Thank you very much. And let me thank Dr. Zango for that interesting lecture. Actually, when I saw the title, Tackling Manpower Shortage in Healthcare, I asked myself a few questions. What are we talking about? There are so many pharmacists without job. There are about doctors around me without jobs. So what are we talking about? Is it there is shortage or there is something we are not doing right? And as you have said, I will talk from the perspective of academics and probably my experience in other places. In the 1970s, 1960s, 1980s, there were so many multinational companies in Nigeria. What were they doing? They were manufacturing here, sort of compounding here. But when it was time for research, they would send the research back to their companies at home to do the research for them. When they found out that Nigerian pharmacists, Nigerian universities were now producing pharmacies because of price increase and all those things, they divested from Nigeria what is popularly known as comparative advantage reversal. They went back home and sold their companies. Nime today was Pfizer and so many other ones like that. With that, there has been a huge gap. The bioactive compounds that we need for manufacture, they are not here. And if you are not manufacturing drugs, what are you talking about? Is it selling of drugs or all these hospital pharmacy they are talking about? So that big gap needs to be filled up. If that gap is not filled, and that's what Dr. Zango mentioned, research and innovation, and that's where I will be talking on. In those days, I even remember that I got 5,000 naira in the early 90s from Welcome, there in Lagos. I was working on something on hyperpigmentation. Today, Nigerian companies do not support research. Instead, they prefer to go and import. And as far as you importing, your capacity to employ new people is limited. And I must inform you, you cannot blame anyone who is running outside the country. When I was in secondary school in the 1970s up to the early 1980s, more than half of my teachers in secondary school were foreigners. My principal was a Briton, but because Nigeria was good then. In the university, I had more than 15 lecturers that were Indians. The person that taught me pharmaceutical chemistry was from Poland. So when people are talking about people jappering or doing all those trash, they have to, people will always go to where they can feed. So that is not even the problem is we lack ingenuity to create new jobs. When I was in the university, somebody told us that there was a committee for the Nigerian pharmacopoeia, and that with that, bioactive compounds will be developed. I don't know what has happened to that committee up till now. I'm already old, and the committee has not done anything. So, can we actually claim that we have correct pharmacists who have capacity to change the system in this country? That's the question I want to leave with us. Because you should note, what you don't produce, you cannot be an active player in it. During the COVID era, I heard that 70% of drugs were imported, of Nigerian drugs were imported from India. And that India gets her own bioactive compounds from China. So assuming today we have crisis in the country, where do we get our drugs from? That's a question I also leave with us. Nigeria is very rich in solid minerals. In fact, the richest in Africa, because I coordinated the World Bank Assistance Project, and we had a center of excellence for solid minerals. Things like kaolin and others can easily be manufactured here, but nobody is looking at that direction. Everybody wants to import. And the Center of Excellence we created in solid minerals has been recognized and given international standard organization number, ISO 9002. These are areas people can work with. Now, even conference sponsorship, the Nigerian companies, before they sponsor you, talk of, I don't know why the companies cannot come together and say, let's sponsor research into bioactive materials. That is not being done. When Pfizer was here, the Pfizer travel fellowship was very strong. Today, I don't know if they are doing anything. If the company that, those that bought Pfizer, whether they are still doing that kind of thing. In 2002, I was to present a paper in Kigali. No Nigerian company sponsored me. I had to get money from Google before I was able to travel there. Now, in Nigeria, too, you have many ministries that can come together. Instead, everybody is telling himself, I'm in charge here. Instead of coming together, sponsor people to do research for them. And until you do research and produce the bioactive compounds, you cannot be an active player in the pharmaceutical industry. And let me also tell you another important thing. When I was in Manchester in 2006, they took me to the back of Old Trafford. And they said this used to be the Manchester Industrial Estate. But now that they've outsourced their manufacturing to Singapore and other places, that most of their children no longer want to read science. That actually they want to read humanities so that when they can graduate, when they graduate, they will join industries so that they can be called celebrities. And so you find out that then I asked them, how are you people able to keep up? How are you people able to keep up inventing and discovering new things? They said they have postdoctoral research system. They bring people from all over the world into their research institutions, into the universities and other places. With that, they keep discovering new drugs. With that, they keep doing new things. And so, I was an Alexander von Humboldt Fellow in Germany, and I was told that the German government, after the Second World War, felt that
Prof, you can round up. Okay. You can round up. You'll still speak
and
later.
They decided to fix just 18 Dutch mark. And as he started yielding interest, using it to bring people into their country. And with that, people were coming from all over the world. Every year, they bring about 1,000 people. That shouldn't be difficult for us. Why can't we bring people from all over the world to come here and do research and do discovery for us and produce drugs that we can use, to keep our pharmacists employed? So they say I should stop. I think I've brought out a few questions. Maybe by the time we start other discussions, I will talk more. Thank you very much for listening.
Yeah, thank you, Prof. That was a marathon. I know if we leave you, you will take all the whole time with your experience. Okay. So we go on to the next panelist. Let's go to pharmacist Taofik Odukoya, Merit Award winner. Can you give us your perspectives in not more than 5 minutes? Thank you.
Yeah, good afternoon. And thank you, Prof. When you have brought me to speak after Prof, it's actually a very, very tough one. But again, I will speak from my perspective as a player in the community pharmacy space. From the data shared by Dr. Zango, it was clear, in line with global standards, that most of the pharmacists actually operate at the community pharmacy level, 42% in Nigeria. And I know that the global data, I don't have it handy, but I remembered I worked on that in the past, and it's actually a lot higher than what we have in Nigeria. Most pharmacists work globally more in the community pharmacy setting. So what are the issues? Some of the issues really is that the poor remuneration is actually a big deal. I agree. But interestingly, the advent of the chain pharmacies in Nigeria, owned by Nigerians, is actually helping to reshape that perspective. I know that today, most of the chain pharmacies in Nigeria will say that, yes, there is a bit of a challenge with workforce, but I think we are still able to actually attract. We are also able to train and retain a lot of pharmacists. And if I use the data available for me in Vanguard Pharmacy, the last 5 years, despite this JAPA syndrome, we have been able to retain over 90% of the pharmacists that have worked with us in the last 7 to 8 years. So the question is, what should we be doing? We need to do something as a critical mass, because it is only when the pharmacist's remuneration is actually significantly improved, that's when we can actually encourage pharmacists to actually stay back in Nigeria and want to remain there. Without that, it's going to be pretty difficult. A lot of people will still want to run out of the country for greener pasture. And that's something I think we significantly need to look into. And why is it that the critical mass of the community pharmacy, where we have the largest player, the largest number of pharmacists work, why do they struggle to actually pay a fairly good remuneration? I think it is still tied to the fact that we still have the open drug market in Nigeria. Access to medication, to drug and drug product is still highly unfettered. You can practically move from point A to point B and pick up any kind of medication that you need, from the controlled drugs to the non-controlled and all of that. And patients will have easy access to that. And all of that are one major reason why it's actually a bit difficult for remuneration to grow significantly in the community pharmacy space. I don't know what we have to do. There has been a lot of noise in the past decade. I remember we spoke about creating the National Drug Distribution Channel. After that, we are now talking of the coordinated wholesale centers and all of that. But the reality is that for as long as there is free access to drug and drug product where anybody can pick up anything, then obviously it's going to be pretty difficult. And that needs to really be looked into, or else we are going to still be faced with a lot of remuneration challenges at that level. Now, I also want us to go into the other area when you also consider the infrastructural decay. Prof was talking about importation. I think I can speak a bit for that too, because it is not as if nobody wants to do any investment in Nigeria. But by the time you look at the cost of doing business in Nigeria, we will realize that it can be highly frustrating. Just yesterday, we heard the news that Guinness, that has been in Nigeria for over 75 years, is actually divesting away from this country. And the whole idea is tied around the economic challenges of the country. And we have seen our own share in the pharmaceutical space too. The likes of GSK, Sanofi, all of them in the last few years has changed their business model. Their medication is still in this country, but again, they have to change business model to ensure that there can still be a bit of continuity for them. So these are some of the realities that we need to look into critically. And when GSK left and all the other pharmaceutical companies in the last few years, the reality is that a lot of the pharmacists that left their employment, a lot of them couldn't even stay back here. They have to begin to look for ways to go to Canada, to go to the UK, and all of that. But the question to ask us is pharmacy profession endangered in Nigeria? And I want to speak from the optimistic perspective that personally, I don't think the profession is endangered, but I agree that there is still a lot to be done. We have a lot to do at the level of governance. We have a lot to do at the level of Pharmacy Council and at the level of the Pharmaceutical Society of Nigeria. We need to ensure that we push for advocacy that would help improve the outlook of the pharmacy practice in this country. Again, if we don't do that, well, one thing is certain. We've always known that nature abhors vacuum, and it simply means that we continue to allow the charlatans to continue to grow in leaps and bounds. And we will know that those ones have less control, and they are able to do and undo a whole lot of things that professionals...
Sister, I think you can be rounding up.
Okay, yeah. We know that the charlatans can do and undo, which by virtue of the kind of training that we have as professionals, we would not be able to do because of our conscience, and because we also know the health implication of all of the sharp practices. But again, I feel like we have a lot to do. But in the space where I operate, I think the chain pharmacist has done a lot to improve the standard, improve remuneration of pharmacists. And obviously, we need a lot more pharmacists to step up into that level and improve the overall outlook across the country. Thank you.
All right, thank you, Pharmacist Taufik. Your contribution shows that you're a specialist in community practice. And of course, your footprints are all over the Southwest. Last time I was at Ibadan, I saw a magnificent community pharmacy around Challenge area. And the signboard read Vanguard Pharmacy. I have to thank you for all that you're doing for community practice in Nigeria. Thank you. So we go to
thank you, sir.
The next.
Yes, sir.
Yeah, we go to the next panelist. So let's look at pharmacist Mrs. Dayo Adetola. Can you give us your perspectives in not more than 5 minutes? Thank you. Is she there?
Yes, I'm here.
Okay. Thank you.
I would like to thank the organizers for giving me the opportunity to speak at this program. Okay, let me just first put the background on table. With COVID-19, with COVID-19, we saw that the technological space became so advanced. The meeting we are having now, before COVID, I don't think there was anything like that. Maybe the highest we had then was Skype. So, but it was after that COVID, people saw that they can have meetings even without seeing each other physically and on and on that. And people started working from home, working online. Then after COVID, when people saw that they can work from home now, many people didn't return to the brick and mortar setup, that is going physically to the office. They decided to start looking for jobs they can do from home. And then because of the advancement in technology, some pharmacies that are actually veered off. They went into technology, they went into IT because they know that quite a number of them are really paying well. Now, let's look at how can we actually tackle this problem. Maybe pharmacy profession being endangered right from the root. Now, I want to suggest something, that pharmacists should actually look into this. That is, we have to look at something that we call catch them young. That is going to the secondary school, because before, I think it was because of some of my friends that made me to read pharmacy. They say, okay, when we're feeling jam for, I say, why don't you put pharmacy? Then I didn't know what pharmacy was all about. I just thought pharmacy was all about just opening a shop, then going to the hospital to count one tablet 2-3 times daily. That was all I knew about pharmacy, yet I still went in for it. So, but when we go to the university setup, the secondary school setup, we can give career talks like for people in the final year about to write their exam, what pharmacy is all about, different aspects of pharmacy where they can work. I think that will broaden their horizon. Now, when they now get to the university setup, maybe towards the end, before they finish, there can be something like another career talk now, maybe in their second, maybe the final year, when they enter the final year, let them know, different aspects or different areas of pharmacy where they can work. Because some of us, when we were in the final year in the university, what was just attractive to us was going to be a medical rep. And everybody will start, once you finish your youth service, you are pursuing it to go to GSK, to go to Pfizer, to go to M&B, and some of the old multinational pharmaceutical companies. So we did know that there are so many aspects of pharmacy that where you can work. Now, you give them career talk, that's the final year in the university. Then you can now call practitioners in the various areas. Maybe a community pharmacist that that this one is doing well, and you call the person to come and speak to them about what community pharmacy is all about. A production pharmacist, call that one to come and talk to them about what production pharmacy is all about. If you want to go into academics, what are the things you need to do? Like if a community pharmacist should come now to come and talk about it, it will let them know that there are still some courses you need to do to succeed as a community pharmacy. Like, for example, you need to maybe short courses like entrepreneurship, retail selling. That would be a lot. One thing I know is that all this idea of leaving the country, I want to believe that if one is really doing well, maybe you have a retail pharmacy shop, you are doing well, you wouldn't want to leave Nigeria. I know a lot of people like that will say, I can't leave Nigeria. Even if I leave, it's just to spend my holidays and come back. Maybe you are a production pharmacist, you are producing, people are buying, you are doing well as a production pharmacist. You will not want to leave the country because that over there is not, it's not a bed of roses. It's only that when people don't have direction, they don't know what to do, that's when they begin to run from pillar to post. And you see somebody who is working in the pharmaceutical setup now, maybe they give him an extra 30,000 naira. He can move to insurance company. An extra 50,000 naira. He can move to a telecommunication company, and the person keeps going round and round. Before you know what's happening, retirement stage are setting. And the person has worked in so many places, not mastering anything. Okay. Now, one thing you let them know that, look, it's not because some of them are thinking, to make money, pharmacy, maybe it's difficult. People in IT, people in this are making more money, people in banking sector. They should let them know that there is no profession, that there are no potentials to make money. I will always say that the same way you have rich accountants, you have very poor ones. The same way you have rich lawyers, you have very poor ones. So if you face a particular aspect of pharmacy, you specialize in it. You know, when you specialize in a particular area, money comes in. Because if I want to engage a lawyer now, the services of a lawyer, and I want to use a SAN, Senior Advocate of Nigeria, I'm likely to, definitely not even likely, I'm going to pay more money than just employing ordinary barrister. Then another one is even among medical doctors. If you go to a hospital, if they refer you to see a specialist, a consultant, you have to pay more money. So now that in the field of pharmacy, now there are specializations. All these things they should let them know right from the time they are maybe at the finishing stage in university. Now we have endocrinology pharmacists, we have the oncology pharmacists.
Pharmacist Adetola, I should start rounding up.
Okay. So you see, pharmacy profession, the way it is, they build so much resilience in us in the school. And that kind of resilience, we can succeed in any field that we find ourselves. Whatever, if I remember one man like that, which is housing solution provider. You know, I'm into training, human capital development. He told me that if you see pharmacists that want to work for me as marketers, fund them, let me have them. It shows that they know that pharmacists, we are very resilient. You know, it's only that many people, they don't have any, you know, most pharmacists, they don't have any sense of direction after graduation. So, and these are the things we should tackle as pharmacists who are already on ground. So I think I'll stop here, maybe during question and answer period. Thank you.
Okay, thank you, Pharmacist Adetola. That's a very great insight into the manpower, into the, what do I call it? Well, manpower training aspect of pharmacy, and also ways to improve manpower increase, improvement in the profession. Thank you. We'll still come back to you during the question and answer session from the audience so that you can expatiate more. Thank you. So we go on to the last but not the least, Dr. Mutala Issa Omar. Can you give us your perspectives in not more than 5 minutes?
Yeah, thank you very much. I want to appreciate the organizers also. This is the kind of discourse we should be having as a professional group, which will help shape policies in our country. And I also acknowledge the past speakers. They have spoken a lot about some of the things I want to say, which I will skip them for now. I want to say that human resource for health, that is HRH, is a global phenomenon. Just like Dr. Zongo said, we have global issue about human health resource. Currently, the data shows that the manpower gap in human resource for health is about 7.2 billion, and is expected to rise to about 10 million by 2030 and 12 million by 2035. So you can see the problems we are in. We are not in isolation. And I want to just kindly want us to focus on one study about human resource for health on only pharmacy, which was done by Bates et al. 2016. They tried to sample pharmacy manpower capacity, analysis of pharmacy manpower capacity globally. But they selected zones like Africa, Europe, Asia, and the rest, and they sample regulatory institutions to see how many people are registered pharmacists, where they are working, just like some of the speakers gave data on percentage of people working in hospital, percentage of people working in community pharmacy. So there is a lot of expose in that study, which I urge all of us to look at that research. That study is a very good, it has been adopted by WHO as a policy statement for pharmacy manpower shortage. And what shows is they took the WHO standard of 1 pharmacist per 10,000 population, and they make an average of a country should have an average of between 6 to 10 pharmacists per 10,000 population. But most of the countries, especially developing countries like Nigeria, which is it's still arguable whether we are developing or not. It keeps hovering since 2001 to till this moment between 0.8 to 1.3 pharmacists per 10,000 population, which is a huge. This shows a huge manpower gap. But other speakers pointed at we're talking about manpower shortage, but we're also talking about lack of opportunities for pharmacists. But what you should look at is pharmacists that have the right skill set. The previous speaker talked about how can you what if you try to employ somebody now, what are you looking at? You are looking at the person that has the right skills. So capacity development is also key. So currently, the PCN says we have about 34,000 registered pharmacists this year. So there has been some improvement in our production of pharmacists in the country, but still we are not going places. We are still at that range of 0.8 to 1 point something per 10,000 population, and I believe previous speakers, some of the previous speakers, I think is the prof that says. Somebody else that said his opinion is pharmacy profession is not endangered, which I seek to differ, because this issue of manpower shortage is multifaceted. Like in our country, in the research I pointed out, they attributed, based on the analysis and based on the their discussion, they analyzed that manpower shortage is directly associated with gross national income of a country and also healthcare budgets. So if you look at it now, we are not earning as much as a country. And also, there is this Abuja Declaration of 2001 that African countries declared that they will be apportioning 15% of total budget to healthcare. Many countries have implemented, like Kenya, like Uganda, like Ghana. Some gradually moved from 5% to 10 to 15, but Nigeria has never had 5% since that 2001 declaration. We're doing 3 point something, 2 point something. Recently, this year we did 4.7. So we are not, healthcare is, and healthcare, the healthcare budget is directly related to whether you have manpower in your country. That is why we see a lot of people. It's not only about remuneration. It's about working environment, infrastructure, a lot of other things. So you see healthcare budget also affects private practicing workforce. Because like
Dr.
you said now,
you should be rounding up, sir. Thank you.
Okay. So I'm talking about reasons why we should expect people japa, like the syndrome we talk about, and also that is also affecting the profession, because as we leave, we give vacuum and other people will take over. Just like we are battling quackery and people coming to the profession, is because of our number. And now these people have become so strong, like the case we have in Kano. We have PPMVs that are registered 1,000 something according to PCN, but the mapping shows we have more than 6,000 PPMVs all scattered in the state, and we have less number of pharmacists practicing. So you see, there's no incentive for pharmacists to practice in community pharmacy because other people have taken that place. So there are a lot of issues to discuss around this issue of human resource for health. I see that as it affects pharmacy. I think I will allow other people to talk before we. Thank you so much.
All right, thank you, Dr. Issa Omar. And with this, we have come to the first round of discussions on the topic. So the floor is open now for the audience. If you have any question, raise your hand and we'll call you to talk. But while we are waiting for the questions to come, let me ask some questions starting from the first panelist. Now, Professor Adiku made his presentations, or his contributions, but he did not really answer the question whether there are actually manpower shortages in healthcare, especially in the area of pharmacy. So, Prof, you're still around. Maybe you can, in 2 minutes, shed light on this while we are waiting for the audience to ask their questions.
I was saying that I do not actually agree with the topic because there are so many pharmacists that are unemployed. So how can you say there are shortages when there are people who are not employed? Now, some people were talking about the skill you have. Can I tell you, nobody comes out of school and is skilled. Skill is gotten on the job. That's why we do internship. That's why medical doctors do housemanship. So, you see, when they advertise for any job, what do they say? 5 years experience. It's when you are doing the job that you get the skill. Sometimes you are even sent for short-term training and you get the skill. So the real issue is that we need to produce the active ingredients and begin to create new companies where people can be employed. If we are manufacturing these drugs here from our own compounds, I've been to South Korea and other places. When you go there, you ask for paracetamol, they give from one plant. So the real issue is that's why I asked, when will Nigerian pharmacopoeia be ready? Because there are so many plant materials we can extract and develop drugs from them. So I've said from the word go, I told you that I don't even agree that there's any manpower shortage. You know, to get a place for internship now, you almost have to sweat. Most of my students from Nsukka, sometimes they take 2 years before they get a place for internship.
All right, thank you, Prof. Thank you, Prof.
Yeah.
We'll still come back to you. We have somebody raising his hand. Abdulaziz, if you're there, can you unmute and ask your question? Thank you. Pharmacist Abdulaziz, are you there? Hello, Pharmacist Abdulaziz, are you there? Okay, yes, if while we're waiting for Abdulaziz, can we go to the second contributor, Taufik?
Okay,
Taufik.
hello, sir.
Okay, is that Abdulaziz?
Yes, sir.
Okay, go ahead and ask your question. Thank you.
Good afternoon, sir.
Good afternoon.
Thanks for the organization of this kind of a good program. So my question is that, how can this present pharmacist regulation assist upcoming pharmacists in being in going into pharmacy business?
Is that the question?
Yes, sir.
Okay, thank you very much. Yeah. So I'll call upon Pharmacist Taufik Odukoya, because I think this should be in the area of community practice. So please make his give his opinion on the question.
Okay. I think the question is actually not as difficult as he has painted it. Depending on the area of practice, I think the new regulation is now, that's the PCN Act of 2022 is now more friendlier than what we used to have, the previous act. And this has actually made it slightly better and easier for pharmacists to be able to venture into any arm of the pharmacy practice. Precisely, I know that in the past, the law used to say that as a pharmacist owner to do a community practice, you have to own more than 51%. Today, the new act is actually reduced that to about 40%. So that means that collaboration and partnership with other people is actually easier more than ever before. The challenge I would normally give the young ones is to start small, but obviously think big. And if you want to start big, then you have to think of collaboration as much as possible. And today out there, they have quality mentorship program that can guide you into how to start any form of pharmacy related businesses. I run a lot of mentorship and I know a lot of my friends and senior colleagues that are also doing the same thing. So I don't think it's more than ever today because of the new improved law that was signed in 2022. But I also have a comment to what Prof said. I don't know if you allow me to comment on that.
I wanted to ask you to also contribute here. Go ahead.
Yes, thank you very much, Prof, for us identifying the reality that yes, we need to create new companies, and I think I agree perfectly with that. And we have to begin to think globally or act locally in Nigeria. But in the area of internship, I think some of our younger ones too are suffering a lot because the government institutions that are supposed to be recruiting are not also recruiting for internship. And thankfully, PCN has moved in the direction of licensing a lot of private players in the community practice to also be able to train interns. We got that license way back in 2016, and we have actually added to that. And currently this year, I'm aware we have one or two of your students from Unsuka doing internship currently in Vanguard Pharmacy. But again, most of the young ones are always fixated and waiting for government hospitals. I don't know why, maybe because they still don't believe that the faster they complete their internship, the better for them. But I know that the young ones also needs to be given that idea that they need to actually look beyond that. Yeah, let's hope government too would improve their capabilities and they can go back to the days where the number of interns that they recruit in government hospitals is also very, very large. But that, for me, is something that has created that gap. Unfortunately, again, there are limited spaces for internship. Post qualification, the pharmacists have a lot more opportunities, and that's when you see a lot of them run out of the country and they can actually choose. Some of them even leave pharmacy entirely to do a lot of other things completely out of pharmacy here in Nigeria. And that is where the real gap we are talking about seriously exists. But during internship, the spaces are limited. Government institutions are not recruiting as they used to do. And that is what is creating that bottleneck for the internship stage. Thank you.
All right, thank you, Taufik. Somebody raised his hand before and lowered it. If you're still there, can you raise your hand again? And while we're waiting for okay, yes, Glorizona Ibe, can you ask your question? Unmute yourself. Thank you.
Okay, good afternoon all, and thank you very much, the panelists. It's actually been an eye-opener. I'm a pharmacist, but not presently practicing as a pharmacy. And I'm actually looking forward to the opportunity that was given by pharmacist Taufik with respect to mentorship. So I don't know if it will be possible for him to drop his contact. I would actually like to get in touch with him to explore that mentorship aspect, because I know it's actually very key in order to help younger pharmacists and even some pharmacists that have actually left the profession and are actually looking at coming back or having another stint at community practice and all that. Thank you.
Okay, thank you very much. So you will get the contact before the end of the program. So, since there is no other question, let me go on to, we have barely 10 minutes to round this segment. Let me go on to Dr. Mutala Omar. Do you agree that there are manpower shortages in healthcare, especially in the area of pharmacy? Because
Yeah.
you did not make any categorical statement on that.
Yeah, I said the data shows Nigeria is doing 0.8 to 1.3 pharmacists per 10,000 population, according to the data. And the WHO standard should be between 6 to 10. And I said partly why I said we need to have pharmacists that with the right skills. I'm not saying we don't have unemployment of pharmacists. We have. Why? Because we have weak regulation. Apology to PCN, but we have weak regulation that a lot of cracks have taken over our jobs. And the only way, if you have this situation, the only way to survive in any profession, in any human endeavor, is for you to make sure that you provide additional value. If we had continued dispensing as pharmacists from inception till now, pharmacy would have been extinct. So we need to add value to our profession. We need to go top of the ladder, because if you look at it, I've been telling people, I said, you see people selling yams. They sell at a price, and somebody will buy that yam and add value and sell 10 times the price of those sellers by the roadside. And somebody will go to GRA and sell and create a very big restaurant, very beautiful, and sell 50 times the second one, because they have added value. So my saying is, if we continue to say we make industries to employ, how many percentage of pharmacists work in industry? If you go to Fitson or EMSO or anywhere, I don't think the pharmacists working there are up to 5% of that or 10% of that, the overall workforce in the industry. So what we are looking at is, since the data shows majority of pharmacists in Nigeria work in community, how can we make sure that those people in the community are adding value to their practice, so that they weed out the quacks? For example, now if you're working in a community, you do additional, you add value to your practice. For example, you create a primary healthcare in your unit. You do, for example, I always give this example. You treat asthma patients. You have your own nebulizer in your pharmacy. You nebulize people as they have asthma attack. People trust pharmacists. They are the first point of call. So those are the things that these quacks cannot do. And in places where you have preponderance of these quacks, like the PPMVs that do what we do, you need to evolve. And that is why I said the right skills. Because if you just practice as a pharmacist, you dispense, you are competing with the PPMV, and you may be selling 50,000 in a day, while PPMV next door will be selling 100,000, because he will go and get drugs from open drug markets. Thank God that now in Kano we have CWC, where I get to see results from that. But we need more regulation. We need to show that pharmacy is more than just dispensing, more than just the mundane things we do. And we can do more than we, that's why I support the task sharing, task policy, task sharing, task shifting policy of the federal government, so that some of the things we do, we can share it with these technicians, and so that we can evolve. We can go on the top of the ladder where nobody can do what we do, and create a lot of clientele for ourselves, and make sure that profession is moving higher. We can't stagnate. And that is why I'm saying that we have unemployment, because quacks are taking over the space. But also, the like policy of this federal government, they have looked at it also, that we have shortage of manpower, and they are coming up with what they call SWAP, sector-wide approach in critical healthcare for manpower, budget and planning. And they are looking at involving pharmacists and other people to make sure that some of the things we come and do in the hospital. Because like I said, the mainstream, when we look at critical manpower shortage, is the patient care. We know that people in the academia, people in the industry are also helping this sector. But that is why shortage in manpower in pharmacy is more critical, because we need pharmacists everywhere. And by shifting some of the tasks we do in the hospital, it will help us to manage the healthcare system. Because as we are now, we have shortage of more than 7.2 million manpower globally. It's even
All right,
worse for
thank
pharmacists.
you. Thank you, Dr. Omar. That's the most we can take so that we can also allow other people to contribute. Thank you. I saw Pharmacist Poluke's hand. Do you still want to speak or ask a question or contribution?
Well, I just thought maybe I should lend a voice.
Okay.
And I want to appreciate all our panelists and you, the moderator, as well. You guys doing great justice to the topic because there's really no time to do so much. As somebody that has worked for some decades in the diaspora, I just feel, let me just quickly drop one idea that can help, that is being done also abroad. You know, there's a problem with the manpower issue with pharmacists globally, even in the United States. We find that most pharmacists congregate at the big cities. There's suburbs, and they are, you know, they are always, you know, having manpower issues of pharmacists. And what they do is that when you have to work in a suburb, they give a higher rate salary per hour as an incentive. They also give relocation package, and they also give a contract, you know, maybe 5-year, 10-year contracts, and give you a lump sum, you know, that if you break within that time, you have to pay back, and some other conditions, you know, that make you stay. You can't just get up and leave, which I think we can find a way about introducing it in our businesses in Nigeria. Concerning, you know, there's so many pharmacies, it's like water everywhere, but not a drop to drink. Yes, there are many pharmacists, some don't have jobs, but then, like the work ethics of some of our pharmacists, because by the number of experience I have, when I walk into a pharmacist, you know, the lackadaisic attitude and some things that they do that employers really, really have to, you know, overlook if they want to keep them. Because they don't really have energized and, you know, vibrant pharmacists out there for most times. And we just have to overlook some of the things so that we can keep them. But that incentive package, 5-year, 10-year contract, we need to, I think if we introduce it, it will help keep our pharmacists for longer than they would have stayed. Thank you.
Thank you, Pharmacist Poluke, for that insight. Very great insight. Issue of remuneration and retention policies to retain manpower. Okay, so yes, I go on to Dayo, Pharmacist Dayo Adetola, to also give further perspective on whether she agrees with the theme that tackling that there are manpower shortages in healthcare, especially in the area of pharmacy. Pharmacist Adetola.
All right, thank you so much. Although I don't have a current data showing maybe the number of pharmacists practicing in different sectors, but you could see the effect in the companies. By the nature of my job, I'm exposed to a lot of pharmaceutical companies, that's in the industry part. And you will see a company with like a free sales force of about between 50 to 100, and they have just one pharmacist. And that one pharmacist is their superintendent pharmacist. Every other person, you know, in the field is either a biochemist or a microbiologist, or you even see some accountants working as medical reps. Then I've actually seen a senior manager in one of these companies complaining that presently, I'm talking of presently, that they conduct interviews almost every month. In fact, there was a time he said almost every 2 weeks you conduct interview. Immediately you finish training them like this, they'll tell you they are relocating. You know, and that takes me back to the point that I mentioned when I was making my presentation, that pharmacists needs, you know, the pharmacists, they need to be given orientation before they leave pharmacy school. Let them know what this practice is all about, the different areas where they can work, and then we bring people who have made names who are succeeding in different aspects of pharmacy to come and tell them these are the things you do, so that they already have a focus as to which aspect of pharmacy do I want to concentrate on. Then already, like pharmacist Taufik now saying that, or there are opportunities for them to mentor those people who want to go into community pharmacies. And then for those people at the production part, they can actually, enlighten the other ones, the young families, that, oh, you can have access to loan, maybe to start your production outreach. For example, back of industries now, I think they give loans if you want to start manufacturing, and then the kind of interest you are going to pay is not like the one you pay when you go to the bank. So when they see light at the end of the tunnel, right from the time they are in school, it will make them to have that orientation. That opportunity, I would say, people in my own set or generation didn't have that. We didn't have people to talk to us. We were just dabbling into, from hospital, you discover that as a medrec, they will give you car, they will give you this, then you go and do medrec job. Then by the time you work little as a medical rep, you will discover they are paying more in this, let's say, telecommunication company. You move there, you just be moving here and there, back and forth without any direction. So the older pharmacists, there's a need for them, like, to give career counseling to the younger ones, and to also encourage them, because like I said, people who are doing very well in their areas of practice, they are not even thinking of, I want to japa, because it's not over there, it's not a bed of roses. If you have family members over there, you will know that it's not really easy there, but many of them, they just think, when I get to the UK, when I get to the US, I'll be collecting social number of thousands of dollars or thousands of pounds in a month. And they will convert it to naira, then it becomes a very big money. But they don't know that over there, you will pay your rent in dollars, we pay it in pound sterling, depending on which country you have gone to settle. So at the end of the day, you just discover that all the money you are making, you are almost like using them to pay bills. So we need to give them better orientation, even right from the pharmacy school before they get out. So that's just my little contribution in addition to what I said earlier on. Thank you.
Oh, all right, thank you, Pharmacist Adetola. We are far gone in this segment. I have a few minutes left. Any other question? Okay, a question from Taufik. 1 minute. A question or contribution from Taufik, please. 1 minute.
Okay, sir. It's actually a contribution, sir. It's not a question.
Okay,
Pharmacist Umar Muitala spoke very well when he spoke around value created in community pharmacy. And sincerely speaking, that's where the mentorship for me actually comes in. A lot of value has to be created. We truly have to raise our practice level far ahead of what people could imagine. For us, we did a lot of work with COVID vaccination. In fact, we were one of the few pharmacies in Oyo State that allowed Oyo State name to be at the highest level during the COVID-19 vaccination data sets. And one of the things we have done afterwards is to, through that, because we train a lot of our pharmacists, to now offer a full-fledged vaccination services in the pharmacy. So we have to keep raising the bar as much as possible and ensure that we stay on top of the value chain. I think I want to agree with him, and I hope, and I also know that the leadership of ACPN is doing a lot in training pharmacists to be able to operate at that level too. And there are a lot of services that can be offered at the level of the community pharmacy that will truly turn us into a primary health center of a sort as much as possible. Thank you, sir.
all right, thank you. Does any other panelist want to make a parting contribution in 1 minute? Michael, Adiku, Prof. Oh yeah, 1 minute, sir.
What I want to say is that we should, in our faculties of pharmacy in various schools, we should begin to emphasize pharmaceutical entrepreneurship and possibly get people to teach our students critical thinking. Thank you very much.
Thank you, sir. Thank you. Then Oguntoye, Pharmacist Oguntoye. Is that a question or contribution? 1 minute.
Well, good afternoon to everybody. My
Good
own area of
afternoon.
contribution is as when we are talking about mentoring, we should also look into the activities of our YPG because most of our younger colleagues are misinformed or misguided by the virtue of this platform and making wrong, unethical, and unprofessional choices. It's later when they now realize the mistake, it might be too late for them to even find their foot in the pharmaceutical profession. So, because like I said, now most of them they didn't even allow the PSN chairman or any of the headers to be on their platform to even see what they are going on, the kind of information they are giving themselves, whether destructive or progressive information. And some of them are victim of a lot of things that even make them to lose interest in the profession at the end of the day because of the mistake of wrong information at the early stage of their practice. Thank you.
All right, thank you, Pharmacist Ateboyega Oguntoye. You're saying that YPG young pharmacists should allow the elders to guide them and to mentor them. It's not just about, because they don't know it all, they are still young, impressionable. So they need senior colleagues that have seen it all to guide them and mentor them so that they don't make mistakes. Thank you very much. And with this, I think we have come to the end of this segment, so I'll just make a conclusive. Okay, let's hear from Dr. Zango in 1 minute. In 1 minute, sir.
Oh, thank you very much, my fellow. It's just you didn't call me for the parting comment. That's why I had to raise my hand.
Okay, sorry.
But this is just to say and to wonder why we always think or present that the PPMDL holders are stronger than pharmacists. This is really worrisome to me because I don't know what they have that we don't have. So we need to really put our eyes together. There is need for collaboration and honest partnership among pharmacists because it's only with that we would be able to address some of these issues. And we must not just depend on the salaries because salaries will hardly change, but we should find a way of creating incentives, that will make our pharmacists to stay across all our operational areas, whether it's community pharmacy, hospitals, or industrial pharmacies. This is very key and this is very, very fundamental. So this is my own parting comment with the hope that whatever suggestions or recommendation we have will reach to the appropriate quarters, either it's policymakers, government, PSN, whoever. Please, the organizers must ensure that these decisions or suggestions, reach to them, because most of the times you will leave these things at the hall where the discussions are always held. Thank you very much.
Thank you, Dr. Zango. Thank you for your contributions. So I'll go to Mutala Omar. 1 minute, parting comments. 1 minute.
Yeah, thank you so much. Yeah, I'm here.
Okay.
Just to give a recommendation, like Dr. Zongo said, I want to say that let's have a communique of this discussion through and push it through PSN to regulatory bodies. At least we cannot change the narrative about shortage of manpower, but we can start somewhere in addressing our own issues. For example, like the data shows that we have more pharmacists in the community, and that's where the opportunities are. Let's create policies that limit the number of proliferation of PBMVs. For example, now in Kano, where I stay, just creation of CWC has improved the sales of our community pharmacists to more than 50%. So you can see now, if we have the space, only pharmacists practicing, imagine how much they will make and how much incentive it will be for young pharmacists to come into community pharmacy. So let's say that as a status, let's PCN limit number of community PPMVs per state and per city. Let them, because by their law, they are supposed to practice in underserved areas in local governments and villages. So when we have that policy in place and we weed them out from the cities like we successfully did in Lagos and Abuja, let's all cities don't have community PPMVs. Let's only allow community pharmacists to practice in the city. Let's take PPMVs to where pharmacists are not available. And with the hub and spoke approach, we can achieve that through PCN. So I ardently support that this meeting should not end here. Let's have a communique. Let's push it through PSN and PCN and Federal Ministry of Health. Thank you very much.
All right, thank you, Dr. Omar. Thank you for your contributions. So the last person, Uba Al-Hassan, pharmacist Al-Hassan, can you give us your contribution or question in 1 minute, please? We are running out of time. If you are there. Pharmacist Ubaidullah Al-Hassan. If you're there in 1 minute, give us your question or contribution. Okay, he is not there. So let me make my concluding comments and then we'll round up. So I thank everyone. I thank the organizers. I thank the board of administrators. I thank the lead presenter, Dr. Zango. I thank the panelists, especially my revered Professor Adiku, and all the other panelists, Dr. Omar, Pharmacist Adetola, and Pharmacist Alfik. It's been a very engaging session with all of you sharing your wealth of experience and bringing it to bear on the discussion for today. Like Dr. Umar requested, I hope the organizers will produce a communique and share it with the relevant stakeholders, PSN, the PCN, the SCPN leadership. And so finally, let me share some of my own opinion on the matter. Yes, I agree there are manpower shortages in pharmacy, and it's because there are few pharmacy schools. We are producing less number of pharmacists every year. There are less number of pharmacy schools than medical schools and law schools. So we should try to create more faculties of pharmacy in more universities. Then there is also need for specialization in pharmacy so that that's a way of value addition so that the take home or earnings of pharmacists can improve. And then I will also suggest that pharmacists collaborate and partner. I don't know why it is difficult for pharmacists to partner in Nigeria. For example, Taufik is into chain pharmacy. I don't know whether he has partners or he's doing it alone. But pharmacists can come together, 10 pharmacists, 20 pharmacists, pool resources together, and start a chain pharmacy scheme. And that way, each person in the partnership will benefit more than just going to work as superintendent somewhere. And also, there should be incentive from the government or from the professional bodies for pharmacists to move into the rural areas. Most pharmacies are in urban areas. In Enugu State, there was a mapping done by PSN Foundation and Society for Family Health. I will find out that pharmacies exist only in about 3 local governments out of 17. But there are patent medicine vendors in all these other 17 local governments. And so that is, that's not acceptable. So there should be incentive for pharmacists, especially the young ones, to move to the rural areas. I've talked about value addition. I've talked about increasing school pharmacy schools across board. And then there should be better regulation by relevant bodies. I don't see a reason why there should be patent medicine vendors springing up in urban areas when the rural areas are not taken care of, lacking in such facilities. So the relevant authorities should stop licensing patent medicine vendors in urban areas. They should move to the rural areas. And then efforts should be made to close the open markets. All the processes that are required towards closing it should be done. Like Kano has done their CWC, Coordinated Wholesale Center. Other states should also come up with coordinated wholesale centers. That way, we can reform the wholesale pharmacy business in Nigeria. So with this, I'll now do a recap, a very short recap of the presentations of the different speakers. So from Professor Adiku, well, he does not agree that there are manpower shortages. Rather, he says Nigeria should support research. Nigeria and the company should support research and encourage local efforts to improve production of bioactives and other raw materials. And also that government should sponsor, sponsor such research in the universities. And for Taufik, he stated that poor remuneration is part of the reasons why there seem to be manpower shortages that make some of the young ones, especially, to move to Japan, to move to overseas, to move overseas. And then he also talked about the open drug market and poor regulation as being responsible for the young ones not willing to remain, but to look for greener pastures. So, and this poor regulation and PPA and open drug markets makes access to especially prescription products very easy, and that impacts on the performance, financial performance of community pharmacies. He advocated for infrastructural development in the area of especially community pharmacy, charging the relevant authorities, the PCN, the PSN, the SCPN, and others to intervene and all work for the development of the community sector, community pharmacy sector. For Dayo Adetola, well, she dwelled on, or rather she canceled on the need to catch them young from secondary school to the universities, especially for career talks. Let the young ones know the pathways that they can take when they graduate, so that they don't beat around the bush. It happened to even somebody like me. I had to move from rep job to this, from one company to the other, eventually to community, and then down to academia. Instead of wasting all these times moving, moving from one place to another, you can choose a particular practice pathway and start early. And before you know it, you are at the peak of your career. He also advocated for specialization in pharmacy and resilience in pursuing one's career. So for Dr. Omar, well, he talked about the ratio of our pharmacists to the general population as against the WHO recommendation. So he agreed that there are manpower shortages, but he said Nigeria is not in isolation, and it's a global fact. It's a global phenomenon. So he also advocated for the right skill sets among pharmacists for capacity development. He says pharmacists should develop themselves and add value to themselves so that they can be more marketed, and so that they can also give more to wherever they are serving. And he also says that there is need for also incentives for pharmacists to practice in the rural areas. So I think these are from their initial presentations. These are some of the things I was able to capture. And with this, we come to the end of this segment. And I thank all the audience that stayed up to this time, the panelists, the lead speaker, and the organizers. Thank you very much. And I hand over to the next Pharmacist Foluke for the final segment. Thank you. Hello, Pharmacist Foluke. Hello.
Well, thank you very much. I think maybe a network.
No. I was talking and then I was muted.
Okay, great.
Yeah, Pharmacist Dr. Okoye, thank you so much. You did my work for me. All the thank yous you've done. I want to thank you for doing that. I want to thank every participant on this platform today. It's been a very enriching exercise and discussion, which cannot be finished. The fact is, as pharmacists in Nigeria, we got to do some things a bit different in terms of how we will keep our pharmacists and how we can attract more. Everything has been discussed. The communique will be done as we always do in pharmacy, in pharmacist affairs. We always do a communique and make sure the right people get it. So it doesn't just end here. You know, that's the reason why we come together for things that can improve the profession and help us practice better. So I want to thank everybody. We've done so well, and this is not the end. We'll keep talking about it so that. But the problem, like you rightly said, is that I don't understand too why pharmacists don't like collaborating with each other. It's as if there's an internal and enmity among themselves or competition that does not help the profession to grow. Because you grow better if you can be united, on the same neighborhood, you have each other, networking. It helps in the long run. But when we get there, I think it's also a Nigerian thing. So thank you so much, everybody. And we appreciate, I've had a very enriching time. I hope you all did. And God will continue to help us. Long live the Pharmaceutical Society of Nigeria. God bless us all. Thank you. Thank you so much. My chairman, do you have anything to say?
Well, to every one of us, it's a wonderful time. And thank you all for this session. And till we come your way again with more important discussion, we say thank you. And all our guest speakers, the lead speaker, the panelists, we appreciate you. All what you have given to us this evening is well noted. And just like has been said, we always come up with a communique after our meeting. So in another couple of few hours or days from now, the communique will be developed and will be sent to the appropriate quarters for proper attention. And I believe strongly there is our own complementary way to advance our practice of pharmacy together in Nigeria. We appreciate you all, and we all have a wonderful rest of the day. Happy Democracy Day, Nigerians. Thank you.
Amen.
Chairman, before we exit, may I request that we all enable our camera so we can have a screenshot for the record. At least I'm happy I'm reunited with my friend now, Professor Maka. He helped us a lot during presidential committee for PSN inauguration. Please, we can enable our cameras.
Chairman, take the picture. Yes, it's also going to be for documentation that anything not captured was never done.
Yeah, exactly.
Well done, guys. You all look good.
Professor Michael, you're looking very fresh.
All right. God bless. And don't forget, some people also jackpot down. There are many people that are jackpot dying. And that place is not as rosy as they think. When they get there, they realize they made a mistake, but they can't. Most of them can't come back. But we need to always have someone to speak. Yeah, we need to have some people to speak on the Japada part of Japaing. So that they should not jump the Japa. If Indians are coming here, Chinese people are coming here to reap our resources, what are we going to do there? There's obviously something they are gaining from Nigeria. It really pains me to the heart when I see this happening, but it's well, we get there. Thank you.
Thank you very much.
Thank you all, and have a wonderful rest of today.
Bye.
Bye.
Bye, everybody.
Bye. Have a wonderful time, everyone. Bye.
For you.
Bye.
Always happy to be on this platform. Yeah, good.
Thank you very much, ma. Bye.
Bye. Well done.
Bye.
Yeah.
Ogare.
Ogami. I can cite you. I'm great here. Thank you. We heard your voice.
I can see you shining like a ray.
Amen.